So, welcome. I am extremely excited to have a very special guest here today, Dr. DeSilva. And Dr. DeSilva and I met a couple months back. Actually, we both spoke at a medical meeting together and really just hit it off. And I thought, you know what? I have got to get him on our webinar to talk about the future of weight loss and wellness supplements, in particular, just with the boom of GLP-1s right now, and we have providers that are, really all in with GLP-1s, but, maybe they have some patients that, don't necessarily want to take an injection, maybe can't tolerate the medications, but still want something that can help them. And then you also have other providers where maybe they're not offering these sort of weight loss medicines, but they do want to be able to support their patients. And so Dr. DeSilva is just a wealth of knowledge and experience. And I'm really, really excited to have him come on today to share with us really kind of what's new and exciting in the world of weight loss and supplements. And so basically what we're going to do is Dr. DeSilva is going to start out and he is going to be talking again more about some of the clinical as well as results that you can get with some of these new weight loss supplements that are on the market. And then I will chime in at the end because of course, all of this sort of stuff is important to bring into the practice, but at the end of the day, you've got to get the word out. And so what I've done is I've packaged together 5 simple tactics that you can start to implement as soon as tomorrow in your practice to really position you as that leader in prevention and wellness. And then I always like to have a couple of fun freebies at the end for you guys sticking with us to the end. But we're going to get started. I'm going to have Dr. DeSilva do a little quick introduction of himself and then dive into the clinical side of things. So I will stop my share and then we'll let you take it over here, Dr. DeSilva.
Great. Thank you very much, Lori. It's a pleasure to be here. Yes, we were very fortunate to meet at this meeting. And I said to Lori, I said, she said, oh, I got to head to the airport. I said, well, I've got a car. I'm going to the airport too. Let's ride together. It was the best airport ride. I wish somebody would have videotaped that I have ever had. So it was a real pleasure to meet you. And thank you for the opportunity to be here with you. I'm an internist. I'm an MD, traditionally trained in internal medicine. This is my 38th year in clinical practice. So I've been doing this for a little while. And I teach at the medical schools here in New Jersey. I have a New Jersey and a Florida license. And my world is really the world of integration. What people call functional medicine today is something I started 38 years ago. Work with nutrients, I work with supplements. A big part of my practice is bioidentical hormones, diet, lifestyle. And I came up with a formula. I've formulated well over 400 different dietary supplements in my career. And the one that I really came up with recently, and I'm going to share my screen here, is something that, a lot of people are now interested, and that is with the idea of the GLP-1s. But the issue that I'm having with the GLP-1s, and I'll go through this in my presentation, is what do you do when you stop? Because the package insert even says, once you stop, you are going to gain weight immediately. So let me go through this and show you what I have done and what this supplement is really all about. If you look at statistics, over 70% of the US population is either obese, but one of the things that really, really bothers me is that 18% of teenagers have a fatty liver. What is the implication of that 20, 30 years from now? So you're a 15-year-old right now. In 30 years, you're 45 and you have cirrhosis, or you're 40 and you have cirrhosis. I mean, the implications of that are just monumental. If you look at the map of the United States and the obesity statistics, pick out the state that you are, where you are, and you can see how dangerous this is. You as practitioners, I don't really need to go through this and tell you the comorbidities that are associated with this. Everything from lung disease and sleep apnea and asthma to the things like osteoarthritis, the musculoskeletal issues, let alone the cardiovascular issues, diabetes, kidney disease, et cetera, et cetera. So you all know this. What are the GLP-1s? The GLP-1s have been the hottest thing in the pharmaceutical industry now for the past, 5 years, 6 years, maybe longer. But the issue is that you cannot stay on these drugs for any long period of time. There are people that have been on these drugs for 3, 4, 5 years. What is the negative when it comes to these? There's a huge issue with the cost, and now a lot of insurance companies are not paying for that. But what about the side effects? What about the nausea, the vomiting, the diarrhea, the constipation, the gallbladder disease, the kidney disease? But here is what I want to stress to you that you may or may not have heard. Number one, when you continue using these drugs, I'm talking about the shot, long term, what is happening is if you have 10 pounds of fat, excuse me, if you have 10 pounds of weight to lose, when you lose that weight, 8 pounds of that weight loss ideally should be fat. And about 2 pounds, a pound or two, becomes muscle. So inevitably, you're going to lose a little bit of muscle. The problem with the GLP-1s long term is that 10 pounds of weight that you lose, unfortunately, 7 or 8 pounds of that becomes muscle loss, and only about 2 to 3 pounds becomes fat loss. What are the implications of that? The implications of that is that the cells go into a senescent phase. Cellular senescence, the body thinks that you're aging because what happens in aging? People, as they get older, they lose muscle. They don't typically lose the fat because there isn't a lot of fat left. So the body now thinks, holy smoke, this person is aging, and the cells go into a resting or a senescent phase. And what do? You accelerate the aging process. I came up with a supplement. This particular supplement has 4 ingredients. 3 of those 4 ingredients are what are called branded ingredients. So what is a branded ingredient? A branded ingredient is an ingredient that is backed by studies, has clinical research, has been proven to work, and is highly bioavailable. And here's the other advantage, folks. When you take a product with branded ingredients, every time you go to buy, you're making a new batch, right? If you're going to make a new batch, you're going to buy ingredients. Every single time you buy the ingredients, you're getting the same ingredient. So the branding allows you to get the same identical ingredient every single time. The 3 ingredients that I have in there out of the 4 that are branded are dihydroberberine. A lot of you probably know berberine. You take berberine. This is not just regular berberine. This is dihydroberberine, and it is a branded form of dihydroberberine called Glucovantage. Chromium. A lot of you are probably familiar with chromium, but this is not just chromium. This is called Chromax. It is a branded form of chromium. And last is capsaicin, and it's not just regular chili pepper, it's called Capsamax. So let's go through these very quickly one at a time. Glucovantage is the name of the berberine. It is 5 times more bioavailable, meaning it is very highly bioavailable and absorbable, and it lasts 8 hours versus the 4 hours that you typically see with berberine. The big issue with the Glucovantage, and as you can see here, it is a branded ingredient right here. It has GLP-1-like analog effects. It increases and improves insulin sensitivity and also carbohydrate tolerance. The big thing with weight loss, ladies and gentlemen, is insulin. You have to lower those insulin levels because if you continue with high insulin levels, not a good idea. Also, you increase AMPK. Now, for those of you that are not familiar with AMPK increases when you fast. So with fasting, AMPK levels go up. When AMPK levels go up, sirtuin levels are also modified. P53 level goes up. P53 is very involved with cancer prevention and sirtuins with aging, right? So slowing down that aging process. And this is a secondary benefit, a side benefit of the glucovantage of this type of berberine. It again increases insulin sensitivity, has a dramatic effect on lipids. So now insulin comes down, lipids improves, etc. Chromium or Chromax, again, a branded ingredient. The company says their logo, lose the fat, not the muscle, which is what you want. You don't want to lose the muscle, you want to lose the fat. The big benefit with the Chromax is it manages your feelings of hunger or satiety. So hunger management, feelings, the satiety, if you will, becomes very important. So you don't feel like eating all of the time. And it manages the carbohydrate cravings. So managing carb cravings, managing your sugar, managing carbohydrates, all becomes really important. And you lose fat and you don't lose the muscle. Again, blood sugar comes into this, insulin comes into this, because we all know that when it comes to chromium, it has to do with carbs and insulin and glucose. 9 patents, 12 supporting human studies, not animal studies, human studies. And chili pepper. The chili pepper extract is, again, it's a branded ingredient, and it increases the heat within the body. So it increases thermogenesis. When you increase thermogenesis, what you're going to do, go here. When you increase thermogenesis, you burn more calories. Now, this is not a stimulant. This is not a stimulant that's going to race your heart. It just increases thermogenesis. So 129 calories over a 4-hour period is what you're going to start getting. And it starts to work within an hour. And you burn about 6% more calories over a 4-hour period. So once again, you start to lose weight at rest. You give your body the burn, and you give your body the metabolism to break these things down. So you burn down fat, you increase thermogenesis, and again, you support your appetite control. And the last ingredient is something called EGCG. This is from green tea. It's an antioxidant, it's an anti-inflammatory, and you can look at this here. It all comes down to what? Inflammation, right? It all comes down to inflammation and reducing oxidative stress. 2021 systematic review, where people experienced significant reductions in BMI and waist circumference when taking green tea over a 12-week period. And again, TNF alpha was reduced, etc. Again, this is where the anti-inflammatory effect really came in. I did a very brief, small study before I released this product with this company. 10 participants, 6 females, 4 males, all over the age of 50. They were all menopausal or andropausal. And the average weight loss, folks, was 2.44 pounds a week. And this was over 69 days. The reason is 69 days because a couple of people ran out of product because this was our beta test phase. So we had to get them product again. But it was 2.44 pounds over 69 days. And on a scale of 1 to 10, how did you feel? How did you feel in this product? And what they said was energy increased, memory increased, focus increased. Just overall, I felt better. This is just a summary of the ingredients. Once again, glucovantage, which is the berberine, GLP-1 like effects without the side effects. By the way, let me say this before I forget to do this. For those of you that are using the injections, and I keep pointing to my arm because I'm not, should be pointing to my belly, but I don't have a belly. But anyway, for those of you that are doing the shots, you can use the Pure Max with the shots. The day you give the person or the person takes the shot, they would not take this product. The rest of the time, they do it. I have a couple of people that are taking the shots. As I said, I don't prescribe them with other physicians, and they want to wean. What I'm doing is telling them, take the shot every other week. Instead of every week, every other week, and use the Pure Max every single day. All right. And again, you can start to wean folks off of the shots because now you have another option or solution. The glucovantage GLP-1 like effect without the side effects also has an effect on insulin. Chromium or the Chromax burns the fat, not the muscle. This is where the appetite suppression comes in. And this is also where the insulin sensitivity comes in and the lipid metabolism comes in. Chili pepper extract or Capsamax burning fat at rest, and the green tea antioxidant and an anti-inflammatory. This is just a comparison between the two. As you can see, the cost, $1,000 per month versus less than $100 a month. Weekly injections versus one capsule, easy to use per day. Synthetic versus more natural ingredients. Side effects versus no side effects. No side benefits versus multiple side benefits. Insulin, glucose, lipids, etc. And should not be used long-term versus it can be used long-term. This is the way to use it, one capsule per day with a glass of water in the morning. I don't want you using this any later than 1 or 2 p.m. 2 p.m. max. I prefer you use it around 10 to noon. If you're on thyroid medicine, you have to separate this, like with any other medicine, by at least an hour or two. All right. But anywhere, if you're not on thyroid medicine or you're not on any other medications, you can take this in the morning. If you are on thyroid medications or other prescription medicines, use it at around noon. That would be the best way to do it. I've also written out some guidelines. You got to give this 90 days, by the way. You have to give this 90 days. I've written out some guidelines on tips, and the website for just the information on the Pure Max is pure-max.com. And Lori will give you some other information as we finish up here. You got to get rid of the sugar, make sure you hydrate, make sure you move, make sure you sleep well, and again, spread the world of wellness. These are, by the way, I have permission to use these folks with their names, their full names. They had no problem with this. Jack was really our shining star. He lost about 34 pounds. He's up to about a 40-pound weight loss right now, and that's where he's stopping. So he's going to go on a maintenance now 5 days a week on the Pure Max. Marcy is over 25 pounds at this point and has lost a lot of inches. This is the big thing that we see is people losing inches. It's incredible. Marcy's been on this probably now close to 50 days, and she's well over close to 30 pounds. And Libby is in the, I think she's around 25 pounds. And again, she's probably at around coming up to about 60 days. So let me just do this. And by the way, and again, Lori's going to give you more information on this, on how to get this. There's 3 ways that you can really get into this and join this. You can get what we call a challenge pack. It's $239. You get 3 bottles of this. It comes out to about retail is $99 a bottle. If you get 3 of these together, it is $79 a bottle. The next one
So
is
people
what
are selling it for around $99. Is that right? Dr.
Yes,
DeSilva? Like
yes,
that's kind of the
retail.
rate. Okay. Yeah. One thing that I was thinking about just as you were going along with this real quick, and I know
Mhm.
you're going to kind of go through some of these challenge pack options, but couple things. So we have like some clients who like maybe they're a medical spa and they're not doing GLP-1s at all, but they want to get into offering weight loss. So I see this being a really good solution for that. And then I think, I guess one question I had is, are most people, like most doctors that you see that are implementing this into their practices, are they doing it as like a 90-day program? So they're just making it clear right at the beginning, like this is going to be a 90-day commitment. You're going to get these, is that how you see people doing it
Yes.
mostly?
Yep.
Okay.
Yes. You know what, Lori? Because if you use this, if you say to somebody, you're going to lose 20 pounds in a month, it's not going to happen,
Right.
right? A lot of
Yeah.
pieces that are involved in this. This is a booster, like this is an octane increaser for the gasoline to get you going. But you got to stop the bonbons and yo-yos too.
Sure.
You
Right. Yeah. Yeah.
know,
Yeah.
part of it
Yeah.
too.
Yeah.
You got to
Totally.
get off your
Totally.
butt. You got to move a little bit. But this is going to work. When you look at all the mechanisms of actions of how the ingredients work, it's going to work. And I've shown you some of the data, and it's remarkable what is happening with the serology, the A1Cs and the lipids, et cetera.
Yeah. The other thing I was thinking about too is like our clients that are doing, because we have a lot of weight loss clinics that we work with that, the GLP-1s are, some of their bread and butter and they're getting great results with it. But it almost seems like this could extend their program, right? So like they prescribe the GLP-1s for, 3 months, whatever their timeline is. And then they could tell them right at the beginning, hey, the great thing is that we're actually also going to be able to put you on a maintenance program. You're going to transition off the shots. Now we're going to have you for 3 months on this. So it almost, to me, seems like it's a way to extend that patient value and keep that patient in the practice. And then the third thing, I know you and I had talked about this briefly, and we've done other webinars about supplements, and we've partnered with some of the, big supplement companies and done webinars. But the challenge with that sometimes is the patient will get the first set of supplements from the doctor, and then they go to Amazon to buy the supplements. And now the doctor, they're the ones that were educating the patient on this. They get them on the first one, then the next thing you know, they're getting them from Amazon. This can only be purchased through their doctor, or they could technically go online and buy it on the PureMax website, but they're going to get it, better suited through the doctor. So to me, that's also a way to like come back to the doctor to get the supplements versus just like going on Amazon.com.
And also, Lori, number one, this is not sold on Amazon in any way, shape, or form. Number two, they cannot go to the Pure Max website and order this.
Oh,
You
okay.
have to go through their doctor's office in
Got it.
order to order the
Okay.
product. Just so that I want to
Yeah.
clarify.
So I think that's huge because, that I see this kind of as a win-win, whether you're offering GLP-1s or not. This allows you to get in the game. And if you're already in the game, it also allows you to have that extended, treatment plan for
Yes,
those patients to get those long-term results and keep coming back and, keeping the weight off.
absolutely,
So,
absolutely. And very quickly, these are some of the other products that I've developed for this particular company. These four liquids right here I use what is called nanotechnology. So it's a nanoparticle, 10 to the minus ninth. Mood is a mushroom product for nervousness, for anxiety, if you're nervous, and also for sleep. The D3K2. It's obviously vitamin D with K2. Flow is a nitric oxide product. Glucose, the combination of the Pure Max and glucose together is unbelievable, is absolutely unbelievable. These are liquids, so it's
they
one
taste
drop of
good
water.
too. I tried them.
They do.
They
They
actually
really
taste good.
do. And then this is the probiotic that I developed. And then this is a facial scan. It's an AI scan that gives you all of your vitals. So this is called the wellness pack. And then we have our Big Daddy pack, which is three of everything. This is three of everything. And quite honestly, this is a most economical way to join because you can sell all of this stuff and you can retail it and you can literally get all of your money back by retailing this in your practice.
And then, so if they get like, let's say this founders pack and they get these, they can sell these retail at the office, and then they can also have a link on their website that would be where the patients could go and just order online through the doctor as needed, right? Like they don't necessarily have, you don't constantly have to stock these in your practice, but it is nice to have kind of that initial pack so that people can see them. And if people want them like to walk out right that day, you've got some in stock, but you do also get a website link where those people can just go on your website. And that's of course something I'm going to talk a little bit about marketing, but that's something that we can easily add to your websites, so that patients can go ahead and just order on their own as well. And then you get the commission on that. You get
Absolutely.
Get a commission on it. So
Do you
I'm
want me to
actually going
stop
to
my
put
screen
in the
share?
chat the link if you're interested in signing up or learning more about any of these challenge packs. I just put that in the chat for everybody.
Do you want me to stop my share, Lori? You want
Yeah,
to?
why don't we do that? And we will definitely have some time for Q&A at the end. But I'm going to actually dive in to the marketing side of things. And Dr. DeSilva, I think you did an amazing job sharing all of that. I know that's usually probably an hour presentation that you kind of jam-packed into a short amount of time. So what I'm going to do now is really talk about how do you implement this sort of stuff in your practice. And the timing of this is great, right? Because we're all thinking about 2025. We're thinking about what can we do to set ourselves apart as that go-to provider. And at Medical Marketing Whiz, for those of you guys that don't actually know me personally, I'm the founder of Medical Marketing Whiz, and this is what we do all day. We partner with the best providers, and we want to let the world know doctors that are advancing in medicine, offering new solutions, all of these things, folks like Dr. DeSilva that are really pioneers, and we want more patients to know about you guys. And so the beauty of I'm going to give you guys just 5 quick tips, things that you can do starting tomorrow. Now, the beauty of these 5 things, I know today we're here talking about supplements and we're talking about weight loss, but these 5 things can really grow every single thing that you guys offer, whether it's hormone optimization, whether it's gut health, whether it's IV therapy, all of these things are going to be applicable to you. The main thing that we have to remember is how are people going about researching you? We know right now that the weight loss market is huge. It is one of the top things that people are searching for online. Now, if somebody is searching for weight loss doctor near me or GLP1s or, wellness center near me, you have to show up when people are searching for you. They're doing this, even if they discover you through Instagram or Facebook or TikTok, they're still going to go and look you up to do their research. They're going to Google you. They're going to read your reviews. They're looking at your website. They're looking for, hey, is this person an authority, an expert in this space? They're looking for your communication style, like things like doing weight loss webinars. I'm going to talk to you a little bit about that as an idea for next year. But at the end of the day, if patients can't find you when they Google you, it doesn't matter what training you have, what equipment you have. It's like the equivalent of having a beautiful office and never putting a sign outside. So we really want to make sure that people can find you on Google. And even if they get a referral from another doctor, 92% of people are still going to look you up and do their own research to validate that recommendation. So I always like to tell people this is a great time of year to just take a look at what people see when they look you up. One of the first things they're going to find is your Google business profile. Now, the first tip I want to have for you, and this is an easy, free thing that you can do literally later on today if you want, claim and optimize your Google business profile. This is going to show up when someone is searching for you before they see your website and before they find you anywhere else. So this is one of the core elements of what we call local search engine optimization. So you want to make sure that this listing is claimed, and you want to go into the back end of this listing and you want to make sure that you have it fully optimized. What do I mean by that? Number one, your business category, right? So if you're a weight loss center, that needs to be your primary category. You don't want your primary category to be doctor. Like everybody knows you're a doctor, but people don't search for doctor near me, right? They're searching for weight loss center near me, wellness center near me, alternative medicine near me, hormone doctor near me. So you want to make sure that you have the right categories. You can have up to 9 business categories on Google. You want a keyword rich description. So if you've added some new services this year, make sure you go in and update your description on Google. And then under your services, add everything that you're doing. If you're doing weight loss, it needs to be a service on your Google profile. If you're doing nutrition and supplements, that needs to be on your Google business profile. And then also there's a little section called From the Business. There's a lot of special categories. So for example, this doctor is a woman-owned practice. If you're a veteran-owned practice, if you're an Asian-owned practice, et cetera, any of those categories you can add to Google. You actually get a little bit of a boost in Google's algorithm. So great time of year to go in, update that. If you're adding weight loss, if you're adding supplements to your practice, make sure that you add that to your Google category. Second tip, email marketing, right? Email marketing actually has a higher conversion rate than both social media and search combined. These are people that are already either patients of yours, or maybe they've opted into your list. They haven't quite been ready to make an appointment yet, but you want to make sure you're staying in touch with these people. Folks like Dr. DeSilva that are an internist, right? Like these people might only be coming to see you once or twice a year. You've brought new services in. You don't want to have to wait till they come in for their appointment. You want them to know what's new and exciting in the practice. You also want them to know you are a provider that is constantly staying on top of the latest and greatest in medicine, letting them know there's a new alternative now for GLP1s and that you're bringing this into the practice. So this is just an example of an email blast that you could send out. I can guarantee you sending this out, especially in January when everybody's thinking about weight loss, you will increase your appointment bookings. You also want to make sure you're doing a monthly newsletter. This is, again, just a way to really be on top of educating your patients. I always like to say he or she who educates the most is actually the best at marketing, but they're able to do it in a really authentic way. So just a monthly newsletter, you can touch on whatever health month it is. You're letting them know what's new in the office. Maybe you've got a webinar or an event coming up. You're sharing some healthy recipes. These are things to really nurture your list and let your patients know that you care. Social media, I could have a whole webinar all on just social media. But the point is that it really, to be relevant now, you have to be active on social media. Now, Pure V, I'm working with them actually right now to develop some really great social media content that can be implemented easily within your practice. That's stuff that we'll be able to share with you guys. But you just want to make sure you're consistent. You're not just posting only on Instagram and Facebook. Think about LinkedIn, all those corporate people that, want to stay healthy for their jobs. You can connect with industry on LinkedIn, and then your Google business profile as well. That is important for search engine optimization. We have a scheduler called the Dr. Social Whiz that our clients get access to, and it'll connect all of these platforms. And all of this content, in addition to our hormone content, our wellness content, our aesthetics content, is all already loaded in here, and we add fresh content every month. It's a simple drag and drop, and it'll post automatically for you on all of your profiles. But just make sure, again, you're not forgetting about being active on social media. But the biggest tip I can give you for this is just pre-plan it so that you're not spending hours and hours and hours creating content. Fourth tip is events. And you guys, events are back. They are back and bigger than ever, to be honest with you. We are seeing huge returns on investment at events. And these do not have to be huge events. Sometimes the 15 to 20 person events convert and bring in more revenue than the really, really big, stressful open houses that people tend to do one time per year. So small intimate, little frequent events, maybe at least once per quarter. You really kind of kill three birds with one stone. You get your name out there as a leader in your community. You will get patients that immediately are like, yup, I'm ready to lose the weight. I'm so glad that this person is offering some alternatives to some of the popular weight loss drugs that are out there, or giving me a long-term strategy to maintain my results. And then you're also going to have some people that maybe aren't ready that day, right? But now they've met you. They've learned from you. They've met your staff. They've seen your office. And they're going to continue to feel how they feel. And if you're staying in touch with them, this is a very lucrative future pipeline. So I threw a few just event ideas on here. Stress management is a great topic. Anything menopause and weight gain, why you gain weight in menopause is a huge draw. So anything related to that is really good. There's a ton of different topics. We also will have people do webinars, right? So a webinar, and this is something I love because you can actually collaborate with another provider and both of you invite your list. And now it's a win-win for both of you, and you're able to reach people that maybe aren't available on that certain day and time to come to the office event, but you can reach them on a webinar. We've done these. This one actually is even from a few years ago with one of our gynecology clients that has a really successful weight loss program. One of the things that we do, whether it's an event or a webinar, is we will help you guys from A to Z with this, whether it's coming up with the presentation deck, designing the slides for you, recording the video, doing the landing page, and getting the marketing out there. We have so many different topics that we can do that we know are proven to bring patients in. So that's definitely something we can help with. The main thing is that you do need to get people to register for this. That is a big lead generator for your practice. So they register, every single person's name, address, and phone number who are attending that event or webinar. If it's in a webinar, I'm a big fan of just the pre-recorded webinar. They can watch it whenever it's convenient for them. You don't necessarily have to do it live. And then there's follow-up, automated follow-up afterwards to get that person to actually convert and book that appointment. How to get the word out. I love this. Dr. Lita Harris, she is amazing. She's a gynecologist that has a wellness center out in California. She does wellness events constantly. She's even started doing them at her church, these ladies events at church. She's had 2 of them already sold out now, and she is incorporating supplements in conjunction with GLP1s within her practice. Getting the word out. You want to have a flyer with the registration code with a QR code. You're sending out emails. It's on Eventbrite. Eventbrite is a powerful place to host your events. You can actually send emails through Eventbrite. You can run Facebook ads through Eventbrite, and they will do the reminders for you. So it's really great. Social media, maybe boosting your posts to get a little bit of extra exposure. Add it to your website. Put it on your Google business profile. Chamber of Commerce. Everyone on this call should be a member of the Chamber of Commerce, local to them. These are local business leaders in your community who want to be healthy, who want to lose weight. These are also great people to partner with. You need to let the chamber know when you have these sort of events. A lot of times they will invite other business owners in your area. You might even be able to do some partnerships, maybe with like a health food store, yoga instructors, those sort of folks. Press releases. I didn't have time to talk a ton about press releases here, but you guys, this is the hidden secret when it comes to search engine optimization. One of the things that I would definitely do if and when you bring Pure V into your practice is launch a press release that tells the media that this is something that is now available locally in your area. It gets you media exposure. And as I said, partner with like-minded businesses. Anything that you guys can create that's a win-win, where they're inviting their list, you're inviting your list, you're able to expand your reach, make a bigger impact on your community is always huge. So thinking about that for events and webinars. And then I wanted to throw one little bonus idea in here, and this is all about working smarter, not harder. If you do a webinar, and we definitely will do this on the webinar that Dr. DeSilva and I are doing today, is we're going to strip the audio of that webinar and it's going to become a podcast episode. So we do this for all of our doctors that we do webinars with. They get an episode on the Top Docs podcast, which is on Apple and Spotify and Google and iHeartRadio. So now they're able to tap into those people that just pop the earbuds in, take their dog on a walk, they're listening to podcasts on the way to work. These tend to be upper income people. So it's just, again, another way to take that one piece of content that you have and turn it into another piece of content without having to do a lot of extra work. So podcasting is another great way to kind of get the word out. So this is, again, is just a real quick checklist: your Google business update, your emails, scheduling your social media, hosting an event or a webinar. And this really, if it were me, giving you advice for the next 90 days and really how to set yourself apart in 2025, it is implementing these strategies. And also, again, to me, when I met Dr. DeSilva and we talked and he kind of told me what he was doing, I was like, man, this to me seems like something that would be such value to, like I said, like even if you're not offering weight loss, it allows you to get in the mix. And if you are offering weight loss, it allows you to offer something that can extend that patient value and that patient journey with you, and really help patients live a healthier, better life. So I wanted to add this real quick. I know I put it in the chat as far as if you did want to sign up as a PureV provider partner, you do earn, and hopefully I have this right on here, Dr. DeSilva, about a 25% commission. I think it actually goes up, obviously depending on how much you're bringing in, but in general, really good actually commission structure for this. So you guys, I will send this out in the replay as well, but this is how you would go ahead and sign up if you wanted to take advantage of bringing that into the practice.
Yes. Yes, it is. It becomes much more lucrative the more people you work with. Correct.
Exactly. Yeah. Yeah. And then the other thing too, just as I mentioned, I promised to give a freebie away to everybody. So we have a book on Amazon.com called Anti-Aging and Longevity Marketing. I'll save you the $20. You don't have to go on Amazon and buy it. We will actually mail you a free copy of this. And then we'll also send you a digital copy as well via email. So you guys will get that. That has a lot of our marketing strategies in it and is a really good, quick kind of how-to guide that will help you guys as you think about next year. And then also I'll put in our strategy call link as well in the chat. So I'm going to pause for questions here. I'll put the strategy call in the chat. If you guys do want to sign up for a marketing strategy call, basically what we do on this, and again, this is a great time of year to be thinking about this. This is the time to kind of reset and revamp your marketing for next year. We will actually do a full marketing analysis of your practice. You will get about a 30-page document. It's going to go through scanning your website. How good is your SEO on your website? It's a good little check to see how the web developer did, making sure you're getting found for those keywords. We'll look up your social media. We'll look up your competitors' social media. We can tell you who is actually marketing to your zip codes and what their ads look like. And then we can talk about some ad strategies for you as well. We can talk about webinar ideas, event ideas, how to build your email list. So I spend a lot of time with people on these calls because I really want it to be a huge value for you. And then you will get that marketing strategy report too. So I'll throw that in the chat as well if you guys want to sign up for that sort of call. So I'll go back to this one. And then if anybody has questions, I know I threw out a couple of my questions to you, Dr. DeSilva, as we went along. You guys can put those in the chat if you have any questions. Hopefully this was helpful.
It was very helpful to me, Lori. Thank you.
Yeah, it was great. It's a good time. It's a good time of year, right? Because everybody's sort of thinking about weight loss and everybody overeats over the holidays. And then it's, we gotta get our butts in gear, in January. And then of course, just thinking about marketing. I think it's a good time of year to just reset and rethink about like, what are things that I can do to set myself apart? And I think this is really a great way to be able to capture those patients that want to lose weight and maybe are looking for an alternative. And then that sets you apart from everybody else. So
I think to get out there as much as you can is, if you really want to build a business, is what you need to do. And that's true from the beginning, right? But anyway.
Exactly. Okay, so I'll put this in the chat here too for everybody, and then I'll send out the replay as well.
Okay.
So if you guys have questions, I'll send you my contact information as well as Dr. DeSilva's contact information. And then we really look forward to helping you guys be successful here in the new year.
Thank you very much, Lori. I really appreciate your time.
You're welcome. All right, I know you got to go see patients, so I
Yes.
will let you go. All
Okay.
right, thanks a lot.
Thanks
Yeah,
so much. Have a
yeah.
great day.
Bye-bye.